Before we get started, I just want to thank Beryl and VDAC again for allowing us to put on this panel. And I'd also like to thank pretty much every panelist before us who expressed how important and how ahead of the curve healthcare and life sciences are in adopting data and AI and ML. So I am particularly proud to be moderating this panel today on the convergence of tech, alt data, and in healthcare we call alt data data, because we've been doing this for a long time with the data that the investment community is now just getting a hold of. AI and ML and other breakthrough advances in healthcare and life sciences. I'm going to start off with specific questions to our panelists. I'll ask each of them to introduce themselves, tell a little bit about their companies, their roles, and we'll learn a lot. So first, I'm going to start off with Sanjeev. Sanjeev, Janssen, which is a part of Johnson & Johnson, is leading the way in using AI to help inform major investment decisions across drug discovery, clinical trials, and commercial operations. Could you share some insights on how AI is transforming these areas at Janssen, influencing the investment and decision-making process, and any specific challenges you face with implementing these innovations in a regulated environment?
Great, Sandy. Thank you, and hello, everyone. Really good presentations today, really smart people. I was trying to absorb all the numbers that were coming at us here. So I work for Johnson & Johnson. I lead their data engineering and machine learning practice there. And in a nutshell, what we do is we build AI-based solutions for namely patients, our doctors, and our customers out there. And then I've worked for a bunch of life sciences companies in the past, so kind of know the journey that we have taken, especially in the AI and machine learning space. And the way we see this sort of evolving on the machine learning side is always sort of looking at from the patient lens first. So how the patient is sort of evolving, what the journeys are taking place for the patients, and then kind of layering in the what we call as the other two Ps, which is the providers, which is the doctors, and then also the payers, what's going on in the insurance space. So these three intersections are the most sort of common ones that we look at. And then the disease state also is becoming very, very complicated now. And this is where the patient journey is starting to become very, very complicated. And so how do you make sure that you're using the data to understand the patient journey, and then making sure that you're looking at these investments that you're making in the data part of it, and then also targeting these patients and these doctors appropriately. So there's a lot going on there, and as we continue through this discussion, we can talk about how that landscape is changing, looking at the patient, and then the various therapeutic areas for the targeting of the patients.
Fantastic. Thank you, Sanjeev. A follow-up for you, Wendy. With Janssen's and other major pharma and biotech AI-focused companies push to integrate AI across the drug discovery and development processes, how does Aetion's focus on real-world evidence support regulatory compliance and decision-making? And are there any particular examples where real-world evidence has proven critical in guiding pharmaceutical innovation?
Sure. So there was a lot in that question, Sandy. Very quickly, I'm Wendy Turenne. I am Chief Data Officer for Aetion, which is a company that focuses on generating evidence from what we call in healthcare real-world data, which I believe is the same as the alt data referred to in the title, but really think about that as the claims data, the electronic medical record data, data from reference laboratories, LabCorp, Quest. Anytime you as an individual touches the healthcare system, that information is recorded and accessible to be used for decision making. And Aetion has technology tools and a centralized platform that life sciences companies, so pharmaceutical companies, device companies, digital health organizations, investors like Sandy, we did some really exciting work together with Andrew as well, are leveraging these data to make all kinds of decisions across the development of their technologies early on through the commercialization of that life cycle. You heard Sanjeev talk a little bit about those use cases. So when we talk about the way that the regulators are starting to think about, we've been sitting in a place for about 6 to, let's call it 5 to 10 years now, where the regulators are really starting to come along this journey of leveraging data that already exists, understanding that there has to be value there, that the technology is catching up and will allow us to access that data, that clinical trials are costly, that there is fault and limitation in what you can study, the patient population that you are able to access. And so, but the regulatory agencies, Sandy, to get back to the original question, I think are really finding themselves unable to keep up a little bit with the advancements in not only the data that's available, the technology tools, I'm going to tee you up on this one, Andrew, that enable us to do, my technical term, really cool things with putting data that used to sit in silos together so we can make even more interesting insights, observations, whether we're using, to borrow language from the last panel, classical approaches or generative AI approaches. And then the AI tools. So the regulators are having a little bit of a challenge keeping up. And at the same time, we see out of the Centers for Device and Radiological Health, for example, that organization has come out strongly and boldly with guidance that has put very clear thresholds and criteria for what they will accept and what they won't accept, for accelerating approvals for medical devices using data and not trials. We've seen the first expansion for an indication for robotic surgery. Not for nothing, this is a device that's been used off-label for over a decade, but now the regulators are using the data to make the decisions. So lots of progress there, but I think that what's even more important is that the stakeholders that are going to drive commercialization and then value, and from what I've gathered in the couple hours that I've been here, the value is what this room is really interested in. The stakeholders that are really going to be in the position to drive value have been using this data for decades and are hungry to access it even more.
Thank you very much. Julia, alternative data often uncovers insights that traditional data sets might overlook. Could you share your thoughts on how alternative data can reveal emerging trends in patient behavior or healthcare utilization, things that are critical in an investment process, and how this might influence decision-making for investors?
Yeah, absolutely. I'm Julia Fitzgerald. I'm the Director of Healthcare Data Sets at Earnest Analytics. So our business model is we partner with companies that have large data sets as a byproduct of their core business, but don't necessarily have the in-house data infrastructure and expertise to monetize those data sets. And so we partner with those companies, we ingest their data, we do a lot of cleansing and refining and transformation to develop actionable products to sell into financial services. There we go. Generally what we found in selling alternative healthcare data sets to financial services is I'd say that there are kind of 3 key areas of differentiation that really resonate for the financial services sector. So I'd say it kind of falls into buckets of like the timeliness of the data as compared to traditional research solutions, the granularity or richness of the data, and then the longitudinality of the data, or the ability to track patient trends over a longer time horizon. And so I'll give a quick example of each of these. So when we talk about timeliness of the data, one of the things, I'd say that one of the most actionable use cases for alternative healthcare data sets in financial services is the ability to predict quarterly earnings. So often when companies report quarterly earnings, there are significant stock movements, particularly in cases where there may be big divergences between what the sell side was modeling for a particular product in a company's portfolio and what the company ultimately prints. And with alternative data sets like open claims data sets that are very low latency, we can often use those data sets, look at utilization that we're tracking in the data set to derive a forecast for what the company is going to print in terms of net sales for a product. And so there's obviously clear alpha to be generated there. So beyond timeliness, another thing that's really cared about and that really resonates is the richness of alternative healthcare data sets. So again, to use the example of claims data sets, there's just by nature, it's a really attribute-rich data set. There's a lot of information that you get about a patient's demographics, about the site of care, et cetera. So for example, there's currently a product that's really topical within the investment community called 𝐏𝐀𝐍𝐄𝐋 from Blueprint Therapeutics. And one of the questions that we get from clients all the time is, how is the drug performing specifically within its newer indication in indolent systemic mastocytosis? And we have the ability to use the dosage that we're observing on the pharmacy claim to stratify volume by the original indication and the newer indication, and understand specifically how the newer indication is performing, which is what investors are particularly interested in right now. So that's where kind of the richness of the data is really relevant. And then finally, to speak about the longitudinality, another thing that is really relevant about alternative healthcare data sets as compared to traditional research is that there's often an ability to track things like the patient journey and follow a patient over time and understand things like persistence. So this is particularly true for something like a closed claims data set. Again, to use an example here, there was a product called Relivrio that came to market in ALS and was ultimately pulled from the market. And we could see using claims data that while we were seeing strength in utilization numbers driven by a lot of new patient adoption, patients were churning off of the drug really quickly. So we were seeing extremely poor persistence trends really early on. And that was kind of a leading indicator of the fact that the product just wasn't demonstrating real efficacy in the market, and ultimately poor data led to the product being pulled from the market. So yeah, I think that those are kind of three facets of alternative healthcare data sets that are really relevant from an investment angle.
Fantastic. Thank you very much. Yeah. Andrew, the opposite end of the spectrum, not focused on quarterly earnings, focused on other things, which we'll learn about. HealthVerity's ecosystem supports aggregation and integration of many diverse healthcare data sets. As data sets and type proliferate, compared to Julia, how do your clients use probably similar data sets in a different way? And how do you maintain data quality and interoperability across these various data sets to ensure companies like Janssen have easy access to data, and partners like Aetion can easily ingest your data or the data that you provide to do their analytics?
Great. Excuse me. Thank you, Sandy. And again, my name's Andrew Goldberg. I'm the co-founder and COO at HealthVerity. We're a venture-backed, essentially a healthcare data marketplace based in Philadelphia. And actually, everybody on the stage here is a customer of HealthVerity. And some of these businesses are actually, we're a foundational data element in the work that they do. And actually, some of you in the audience are customers as well. So I feel just at home today. By saying we're the largest marketplace for healthcare data, essentially what HealthVerity has done is created software that ultimately manages the identity and privacy of US healthcare data on a national basis. And we have developed relationships with about 75 different data sources around the country. This is going to be medical claims, pharmacy, lab, EMR, death data, consumer data, et cetera. And the biggest misconception about healthcare data overall is that because you go out and license healthcare data, you can actually understand the complete journey of a patient. But healthcare data is really like Humpty Dumpty. It falls off the wall and it breaks into 1,000 pieces, and it's really hard to reassemble the entire journey because nobody actually knows the denominator of any single patient with respect to the data. And so there's a lot of companies who are ultimately trying to license certain data types because they think the whole answer is there, when in fact it's not. And I'll give you a really good example, especially for your space. Specifically for those people trying to follow drugs of certain drug companies to predict earnings, some of those drugs may actually be blocked in what's called open claims data, but you can follow that patient in closed claims where the data is not blocked. And so understanding how to curate, how to synthesize, how to organize the data to ultimately ask the right question and get the answer to that question without jumping to a data conclusion is a really important part of what we do in operating this marketplace and then synthesizing data around answering specific questions rather than licensing specific data sets per se, right? As compared to the financial services segment, where so much of the focus is on what happened in the last 90 days because you're ultimately trying to predict quarterly earnings, with a client like Janssen, we're looking at data over a decade, right? Because diseases can be slow to show themselves. You've got lots of comorbidities or what's called other diseases that develop in patients. You want to understand not only the health journey, but the treatment journey, the lab journey, right? And Janssen's been great about synthesizing different aspects of our ecosystem. In fact, they license more than half of our entire ecosystem for the work that they do. And there's different stakeholders who are trying to answer different questions. The data itself is very fungible. It can just be pivoted to answer the questions, whether it's patient-oriented, it's physician-oriented, it's payer-oriented, hospital system-oriented. So it's very fluid in that way and understanding the right way to get it to work. But an organization like HealthVerity is really critical to make sure that we can synthesize the right combination of data so that you can answer exactly the question that you want without licensing lots of data that has no yield and no return for you.
Thank you very much. I'm now going to ask a general question, and maybe we'll just go down the row. So each of your organizations is driving innovation in healthcare and life science, albeit in different ways. How are investors leveraging your advancements to create alpha? And in finance, alpha means profit. At Johnson & Johnson, it means literal profit. How are investors leveraging your advancements to create alpha or increase revenues? And what investment strategies do each of you see most promising for the future? Start with Sanjeev.
Yeah, so Sandy, I'm not an expert on the financial side. I do know the life sciences space better, so I'll give some inputs and I'll let others sort of pitch in. How you can make sort of investment decisions in your respective areas. So as I've been in life sciences for the last 15 years, one of the interesting dynamics that we are seeing is that, and again, these are my opinions, not the opinions of the company, just as a disclaimer, that blockbuster drugs are starting to wind down. I mean, if you look at your Lipitors and your Viagras of the likes in the 2000s, you're seeing less and less of that happening. And so what the big pharma companies are now trying to do is get into more specialized areas. And we're seeing a trend where, the oncology and immunology aspects of what we call as the therapeutic areas are becoming more prevalent. And there's a lot of focus on that. At J&J, we're focusing on about 70 product launches. And out of that, 90% of them are in the oncology and immunology space. And with that, like I talked about before, that the complexity of this treatment of diseases is also becoming more and more obvious to all of us. So, the way we are starting to think about this is, okay, how do we target the right sort of customers? Again, it's more around accounts. Healthcare accounts is what we are going after. So the more we can understand the healthcare accounts, which you think about the hospitals, you think about the big companies out there that are purchasing in bulk, those are the ones we are trying to now target and trying to sort of understand better. And so that's one shift that we're seeing. The other is a lot of these major products, billion-dollar drugs are coming off patent. What we call as LOE as well. And you see that in 2025 going into 2026 onwards. And that's, these product launches, hopefully, that we're looking to have will offset the revenues, the loss of revenues that we're going to see from these drugs. The other aspect that we are seeing is, the IRA, the Inflation Reduction Act. And this is where the pricing pressures are starting to kick in for pharmaceutical companies. And we're also looking, how do we sort of counter that, as we move forward. So, and even more push then into the oncology and immunology space especially for big pharma.
Great, thanks. Julia, how are investors leveraging advancements at Earnest?
Yeah, so I think this kind of connects to some of the things I was hitting on previously, but I generally say that like alpha generation based on our products kind of falls into the category of using the data to gain a competitive edge around quarterly earnings, as I kind of spoke to previously. We're using claims data sets and other data sets to put together quarterly earnings forecasts for really highly cared about products. And then we're proactively flagging to our clients cases where we think that there's a meaningful potential for a beat or a miss relative to consensus estimates. And in the best case scenario, you can correlate that with a real stock reaction. So we can see that a stock goes up when there's a meaningful beat relative to consensus, and we can forecast that. And so it's really measurable. And then outside of kind of the more short-term quarterly earnings forecasting category, there's longer time horizon questions that our clients are asking. So things like I mentioned around persistence or growth and adoption in particular indications. And so looking at kind of secondary metrics that may, like things like, for example, we get a lot of questions around persistence on GLP-1s. So obviously we know that there's a massive market for GLP-1s, but there are questions when we think about net sales potential, like peak sales potential of these products around, well, what really matters is like what % of patients that start on these therapies are actually staying on them durably over time. And so that's, again, like not gonna be something that materializes in a single quarterly earnings event, but is gonna have real implications for the trajectory of the stock over the longer term.
Wendy?
Yeah, I think, so similarly to Sanjeev, I can comment a little bit on the investor perspective, and I think it's, at Aetion, we are really focusing on the tools for decision making. So across the board, whether it is investors or life sciences companies, device manufacturers, companies that are evaluating how to put digital health solutions in place for whatever problems they are looking to address with digital health solutions. I think that they are leveraging the tools to make better decisions, right? And that's really where the innovation is coming in, thinking about making those decisions differently, looking for unmet need in a different way with new data, looking to understand who is actually prescribing drug and where. With the GLP-1s, for example, you aren't seeing those prescribed in what we would have called classical healthcare settings before. It means they are often not seen in previous kind of traditional data sources before. They aren't being covered by payers yet. So it's really early to be able to understand what really is happening, just as some real examples there. So we've had some real challenges there. And then there's a lot of innovation and focus from an investment perspective on how are we going to do more to get more information out of the technology that we are applying to patients. The biggest example that I'm going to use to try to translate that statement for you is, how do we use AI to get better, faster, and more information out of when we give patients MRIs or when we scan tumors? How are we going to use the technology tools that are now kind of raining down on top of us to get more and better information out of the data? And then how do we put those in place to make better decisions, right? Biggest innovation, best innovation you can make is better decision making. So that's where our customers and our investor partners are challenging us, and that's where we will focus with our partners to do better and do more.
Great, thank you. Andrew.
Thank you, Sandy. I think this one's actually straight down the middle from my perspective. It's coverage, it's novelty, and at the end of the day, it's privacy and HIPAA compliance, right? Which pretty much no one in this room is good at, except maybe for some of us on the stage. From a coverage perspective, because of that denominator problem, right, you really need the broadest coverage if you're going to get to the most accurate projections overall. And so the ability to synthesize across data sets, potentially, or to work with like an Earnest who's doing that synthesization for you, I think is really, really valuable, because you're going to see more of the market than you would probably see on your own. The second is novelty. Depending on how you actually think through the question, if you take a marketplace like HealthVerity, where we're seeing these expansive and also niche data sets, the ability to link them together and then synthesize that can show you things that you generally can't see anywhere else even some of the traditional go-to places that the market has gravitated to. And the third part is the HIPAA compliance. Because of the HIPAA regulatory framework across healthcare data, which is not true across a lot of the alternative data sets, the fundamental ability to deliver a data set that is already HIPAA compliant, that has already been normalized and transformed in a model such that you can actually just put it right to work, saves a lot of organizations here a lot of compliance issues and a lot of delay in making sure that the data is actually fit for purpose so that you can do the work that you want to do. And so I think, again, between the coverage, the novelty, and the privacy management, that's what we're really seeing in creating alpha in a lot of our clients.
Can I just follow up on that? I love that you said the novelty, and there's something that you said in there that I think is just really important for this audience, and it's about asking the question. That's the best and most important innovation, sort of push towards innovation. When Sandy first came to us in thinking about the data that we were using as an investor and really applying what was a traditional healthcare study lens to some of the questions he was trying to answer as an investor in portfolio companies, he was asking questions that maybe we had heard before, but in a different way, and really pushing us to think about those questions in a different way. And so I just wanted to kind of take a minute and hit on the novelty and the question asking, because the more that we are asking new questions or even different questions and really push the data to answer those new and different questions, I think that's where we get the fun stuff done as we think about data and innovation.
Thank you all for the answers to that question. As Andrew noted, we all work together in some fashion as data providers, data consumers, analysts, along the data value chain in pharmaceuticals. So there's a lot of value from partnerships and a lot of value from having the right client. Maybe we can go down the panel again and for each explain what role do partnerships play at your company to advance. I think we're all in real-world evidence, but also integration of new and sophisticated methodologies around AI and ML. And are there any collaborations or alliances that have significantly enhanced your ability to generate insights for your decision makers? I can tell you that because you're all on my panel, you've all added value to my business, which I really appreciate. But over to you, Sanjeev.
Well, thank you, Sandy. Yes, I mean, as Andy mentioned, and Julie and Wendy as well. I mean, we partner very closely with our data providers. I mean, HealthVerity is one of the major data providers for us right now. I mean, if you think about in the U.S., we're running about a $30 billion business across all the therapeutic areas. I'm just talking about the pharmaceutical business in the U.S. And, to drive the decisions, to just find those healthcare accounts that I mentioned, the hospitals or the doctors, at that precision level, you need data. You need the accurate data. And it's just not just one single set of data. You need multiple sources of data to be able to get to that level of insights. And again, HealthVerity is a great partner to us. We do leverage a lot of multiple data sources. And again, HealthVerity provides us that marketplace. But then, there are other data sources that's coming from Viva, that's coming from Symphony, that's coming from now the digital space as well. I mean, we're starting to push the envelope on the digital side, especially with this digital health, precision medicine sort of kicking in. How do we sort of leverage the data? And for us, the competitive advantage comes from which data providers can blend this data for us in the most sort of appropriate way so that we can get to that precise patient and also the patient journey very, very, very accurately. Wendy talked about the speed and the agility. That's the other thing sort of we look at, where how do we make sure that, if it used to take us 3 months to get the insights on these patients or these doctors, how can we do that in a week's time? And that's where we're leveraging a lot of the technology. Again, the cloud platforms are are really helping us in harnessing that level of compute power and the speed that which we can get these insights. On the generative AI, I mean, we've heard a lot of conversations on AI and specifically around generative AI. I mean, my point of view is that pharmaceutical companies usually are laggards in this space. I mean, in adopting these technologies, and so we are seeing that. I mean, we are running about 100 proof of concepts right now in Johnson & Johnson related to generative AI. We haven't really seen that level of uptake, whether it's drug discovery or any kind of sort of commercial sales and marketing applications just yet. We also have a lot of skeptics in the space where is it really going to work? So we're going through that hump, that uphill battle, if you will. I am optimistic that we'll cross that because I see a lot of potential in the generative AI use cases. But again, we're still in its infancy when it comes to generative AI.
Great, thank you. Julia, what makes for a good data set or vendor to participate on the Earnest platform, and what makes for a good Earnest client?
Yeah, absolutely. So obviously our business model really hinges on partnerships. We don't generate any data in-house for the most part, and so we are sourcing data from third-party companies. And when we think about like high-quality partnerships, obviously we're looking for data sets that in themselves are really high quality. So data sets that are attribute-rich, that are low latency, that are just providing a lot of differentiated value to financial services, that are covering a really broad range of products. So breadth of coverage really matters. But we're also looking for high-quality partners in themselves. And so obviously, healthcare data is really complicated, and we found that sometimes there are companies that have really excellent data but don't have strong data teams and understanding of their own data and the ability to kind of like collaboratively work together to generate the best product possible. So we're looking for generally like partners who have a high willingness to kind of collaboratively work on bringing to market a product that we think is going to really resonate. And so, yeah, that's when we think about good partnerships. We're obviously looking for the best-in-class data sets, and then we're also looking for partners that are willing to build a really strong relationship in bringing those products to market. And then as it relates to good clients, obviously, I think generally there's just a really wide range of levels of sophistication within the clients that we're working with. On the one hand, we have platform funds that have huge in-house data efforts and are really sophisticated, and they're really deep in the weeds of the data. We're learning a lot of things about the data from them because of their level of sophistication is so high. And that, in a lot of ways, can be a really great client. And then on the very opposite end of the spectrum, we have much smaller funds that might be very healthcare specific, don't have in-house data expertise, but have a very deep domain understanding. And we're learning a lot, getting a real pulse on what's most topical in the healthcare industry because they have really interesting investment theses and a really strong understanding of the landscape. And so that's also a great client. And so I think like what a strong client looks like, it really ranges from the less data sophisticated, smaller funds, but that have really interesting theses to the most sophisticated.
Thank you. Wendy? What makes for a good data source for your regulatory grade real world evidence, and what makes for a good client?
All clients are good clients. We're not going to turn away any clients, Sandy. No. I think, look, what makes for a good partner, I'm going to echo everything that Julia said. Quality might mean something different here and there, right? We need a good strategic fit in our business. Frankly, I don't need 8 different open claims data sets that have all of the same data, right? But I do have customers that are going to want both the very deep clinical data and something more broad. So I am looking to put a partner ecosystem together that is diverse, that provides the coverage and can go very deep when needed. And look, I think that when we think about what makes for a good anything, we're always going to come back to a platform framework and platform thinking. The idea here is bring everyone together around a platform that has the agility, the flexibility, the elasticity to support your scale, to support the data that you need when you need it, the different analytic applications for your that can produce results for the different stakeholders at the right time, right? And so that it's the match of the flexibility, the agility, the scale, the velocity, but it comes down to bringing everything together, understanding what you're asking, be intentional about asking it, understand fit for purpose. One data set, one analytic tool does not solve everything. Just work together to solve it from there. Andrew?
Sure. So as a marketplace, we sit between the buyer and the supplier, and we need to make sure that we have really strong partnerships that are bi-directional. So in terms of the earlier question about seeking alpha, our role is to develop the most sophisticated relationships and partnerships with the data owners who are going to be licensing data through the platform and allowing that synthesis to take place, the synchronization of the data, because the rising tide for each data provider makes everybody's data ultimately more valuable. As a marketplace, we ourselves don't do any analytics at all. We sort of treat ourselves like Switzerland, and that's why you hear us talking about data being distributed and analyzed through an Aetion or through an Earnest, or ultimately even through a Janssen, because in the case of Janssen, where the amount of data that they're consuming is so large, we're actually building custom cohort building tools to help them find signal faster, maybe faster than they can even process on their own, to then feed more sophisticated and more narrow data cohorts into the work that's happening in the ML/AI side, right? So depending on the type of customer and the go-to-market, we'll identify best-in-class analytics partners to be able to take that data and actually turn it into something far more valuable, the information that you can make better decisions upon. That's how we think about it, Sandy.
I didn't know you were building cohort tools. Now I'm mad at you.
Really good like you.
We only have a few minutes left. Do a speed round. We'll start with Andrew. Again, almost every panel today mentioned the importance of and the leading place that healthcare is playing in AI, the adoption of AI, ML, and the explosion of data sources in healthcare. 30 seconds each. Future vision for 2025 and beyond. Looking forward, what breakthrough technologies or market shifts are each of you most excited about over the next year or so?
So I'll just start with AI in general, right? The best data will result in the best answers. A lot of the open source data and traditional data sets aren't going to generate the kind of signal that you want. And also think about the data that we're talking about today as the intellectual property that's owned by the data owner, right? And just like none of you want your intellectual property being distributed into AI because you can't get it back once it goes there, right? I'm not like Spotify. Spotify, you stop paying, you can't listen to the music anymore. That data goes into AI, it can be used there forever until it becomes obsolete. So it's a very different licensing and economic model. And so protecting the intellectual property of the data, ensuring the best data goes into AI, that's the biggest trend I think you're going to see in 25 as there's more adoption. How do you actually figure out the right models to get the best data into your model overall?
I am eager to see in 2025 how we, at least in healthcare, are going to come together around understanding quality of AI tools, validation of AI endpoints, or the information that AI is going to generate, and how we've had a really hard time doing that with what some would consider standard clinical outcomes. I'm anxious to see how we come together around using AI in treatment decisions.
Yeah, so I think at Earnest, as we think about AI, generally, like one of the focuses is thinking about how we can leverage AI to improve the way that we're normalizing the data. And so like a quick example here, obviously I've talked about the importance of low latency in financial services. And so with medical claims data sets that fundamentally have a certain amount of lag, we're starting to think about how we can use like a combination of machine learning and AI to develop superior backfill methodologies to sort of backfill claims that haven't yet actually appeared in the database or form predictions around that. But yeah, so there's a wide range of different applications, but we're excited to kind of incorporate AI methodologies to improve the quality of our normalization techniques.
And just quickly for me, at J&J, we're super excited in the next few years if we can use machine learning to understand the specific patient's journey much, much better. I mean, again, using data from HealthVerity and other sources, how do you make sure that you can actually get to the right patient at the right time with the right medication, that would be, the most exciting part. And again, driven by machine learning algorithms.
Well, I, for one, look forward to generating lots of alpha with each of you in 2025. Let's thank our panelists. Thank you all. Thank you for your time and sharing your insights with us today.